Low-value care is a term in medicine that describes procedures and tests that have little if any benefit, waste money and can do harm. Think of unnecessary antibiotics being prescribed or an operation where the risks outweigh any potential benefits. So what drives doctors to recommend these for patients, and what do patients themselves think of it? And a surprising possible side effect in how long you have to wait to see your doctor. Health policy researcher Dr. Prachi Sanghavi from the University of Chicago has recently published a fascinating study which has exploded at least one important myth. Thank you very much for joining us.
Thank you so much for having me.
Now, we've done a lot on low-value care over the years, and we tend to think of it as things like not having an arthroscopy if you've got arthritis of the knee, unnecessary antibiotic prescribing and so on. And as you rightly say, the driver for the paper is that a lot of doctors are nervous about denying low-value care because they think their patients will just go down the road to the next doctor.
Right, so we don't exactly know what happens in that interaction. A lot of it is based on anecdotal evidence, but it's possible that low-value care is demanded by patients, and that is a narrative that physicians have. It's also possible that some physicians provide it to look like they are doing something for their patients, or they are substituting lower-value care for higher-value care, because they are overwhelmed and aren't able to provide the required attention. There is also, of course, financial incentives to provide more low-value care. So why it actually occurs is not clear, but these are the stories out there.
But what you wanted to do in the study was actually find out whether or not, even though it is low-value care and it wastes a lot of money in the healthcare system, sometimes causes harm, is such as with antibiotics and maybe unnecessary arthroscopy, do patients actually appreciate and get a better experience out of it?
Exactly. So we were looking to assess the relationship between exposure to more low-value care and patient ratings. So we wanted to know if the doctors who provide more low-value care are really getting the better ratings that they think they might be getting.
So how did you do that?
So in the United States we have Medicare as our large national insurance program for people over 65 years, and we have insurance claims for a 20% random sample of Medicare beneficiaries. And we use these claims to estimate the amount of low-value care that each primary care physician's patients received. This is each primary care physician in the United States.
How did you know it was low-value care?
So we followed a literature that is pretty established now, and actually one of our co-authors helped develop, on identifying low-value services in insurance claims. And the low-value services are identified from professional medical societies that have come together and identified services as being viewed professionally as low-value.
And the sort of things that you described there: PSA tests in men over 75, spinal injections for low back pain, antibiotic prescribing, and having a gastroscopy if you've just got a bit of indigestion. So what did you find in the end when you assessed patient satisfaction in relation to all this?
So we found no association between patient experience ratings and the amount of low-value care the patients received. The only exception was wait time. We found that patients who receive more low-value care recorded having appointments that started late, and we don't have a very good explanation for that. One possible explanation is that
so the GP was so busy providing low-value care he or she had a backup.
Right, and so these are physician practices that are running behind schedule, and possibly means that they are poorly organized, and so they are actually providing more low-value care instead of higher-value care.
So what's the takeaway message through this for? People listening to us are actually potential patients, members of the public, rather than physicians. What's the message for the public out of this?
The message is, I think, really more for physicians and policymakers. So for physicians, we hope this helps alleviate the stress they might be feeling around leaving patients possibly dissatisfied because they don't do something the patient asks for. It should also alleviate pressure to provide more unnecessary care in order to boost the ratings.
And we should say here that in the United States people are obsessed with this, that you rate your doctor, and it has an impact on your practice, more so than here.
Yes, in the United States this is a really big question, and the reason is because we have a number of large national initiatives that are aimed at driving up competition between physicians through public reporting of patient experiences. And also there are alternative payment models in the system, which actually reward physicians who have higher performance. So from a policymaker's standpoint, there is concern that the use of these patient experience ratings could actually drive up the use of wasteful care, so it's an unintended consequence. And so the takeaway message for a policymaker, at least in the United States here, is that they don't need to worry about that patient experience ratings are likely going to provide. Based on other studies, we know that they can contribute useful information about the quality of care, and it's unlikely that they are going to be causing damage in terms of driving up wasteful care.
Fascinating. So we look forward to a transition to high-value care in general practice. Thank you very much indeed for joining us.
Thank you so much. I really enjoyed it.